Talk more about vaccine hesitancy here in Wisconsin. Dr. Noelle LeConte, an oncologist with the UW Cancer Center, is joining us. Noelle, thank you for joining us here at 4. In Wisconsin, the vaccination rates for the HPV vaccine, we want to talk about that specifically, it remains below the national average despite evidence it can prevent cancer. Why are we seeing that?
It's complicated. People don't realize that they need to be vaccinated or their children need to be vaccinated. You can start as young as age 9, but people are not seeing the pediatrician as regularly then. And then there's the usual vaccine hesitancy that we've all learned about with the COVID vaccine, uncertainty about benefits, risks, alternatives. But the message we want to send home about HPV is that this is a cancer prevention vaccine, the only one of its kind. And really, you need to get it started as children to prevent these really, really terrible cancers.
You mentioned the hesitancy over the COVID vaccines, so many of them now available over the past year or so. Are we seeing any movement away from hesitancy? We know there's been a lot of awareness from public officials, health officials pushing vaccines. Are we seeing any change?
Not with HPV yet. We're seeing a reduction, partially because people were concerned about coming into the doctor with the pandemic. We've seen pediatricians' offices do really creative things like vans that drive to your home to give you the vaccine, but the latest numbers we saw were down from where we're hoping. We're hoping to get kids 80% vaccinated against human papillomavirus, and the last time we looked in Wisconsin, it was under 50% and falling, unfortunately.
And if someone does not get the HPV vaccine and unfortunately does get cancer, what's the treatment look like there?
Yeah, so we're talking about several cancers: head and neck cancer, cervical cancer, penile cancer, vaginal cancer, and anal cancer. All very, very hard to treat, usually with radiation and chemo and often surgery. So we really want to try to prevent those. It's much easier to prevent getting this vaccine or the virus from living in those organs and causing you cancer.
Nicole LeConte.
Really hard cancer to treat.
Thank you very much, Nicole LeConte. Thank you for your time today here at 4 o'clock.
You're welcome.